Hey everybody, it's me again. I just wanted to make another video. I'm so sorry about the quality of my camera. I'm now using my webcam on my computer, so the quality is pretty bad. I wanted to, and I'm sorry because the camera keeps moving because that's my face focus, I guess. But I wanted to show you guys some of the materials that I did get before my video cut off, unfortunately. So I got a stethoscope. Oh, and again, we got a bag. So basically, here's the bag that they gave us to use, to have with our expensive tuition. It's a really big bag. It comes with lots of good things in it. And I'm just going to kind of go through quickly and show you guys. I'm not going to spend too much time. Also, you guys, this is our uniform that they have us wear. We'll also be wearing this when we start clinical. So it's just gray scrubs and pretty simple, basic. Everybody wears the same gray. It's steel gray. So they gave us a stethoscope. This is just hand sanitizer, which I'll probably take off. I just have this on for now. But this is our stethoscope. It has the double bell. So it has the bell and the diaphragm. You can turn it on or off. Okay, so you can listen to sounds with this side, or you can listen to sounds with this side. Okay, and so I'll put this back in the box. This came in a regular box like this. Okay, now let me get to the more interesting things that you don't just see every day. And I really wish this camera would stop moving. Let me see if I can click something to stop it from moving like this, because this is out of control. Hold on, y'all. Okay, so now it should stop moving like that because I just clicked something. Okay, now, so in our bag, the first thing that we have, which I already was kind of messing around with because we had to do a wet to dry just dressing change check off. So we have a dressing change tray. And all that does, it comes with, we have our sterile, I forgot. Oh my God. We have this to lay down on the table to create your sterile field. Then we have scissors, some gauze. We have a biohazard bag, some iodine sticks to clean the site. We have tweezers so that you can remove the dirty dressing. We have tweezers so that you can pack the clean gauze, tape. We have a very large bandage so that way you can put over if there's extra exudate or drainage. So you can just put this on top and then tape it down. But you only need it if it's like excess drainage coming off of the wound. So I'm going to stick all that back in the little pack. And then I'm going to go through the next one, okay? And again, we're going to do this kind of quick because I'm going to start watching my shows and relaxing because it's about that time. Okay, so we got that one. This is just our sphygmometer or our blood pressure cuff. So pretty simple. Here's a little, and it's just all in there. Just the usual, you know how that looks. I'm not going to go too deep into that. Then we have, what is this? Irrigation tray with the bulb syringe. We have not opened this up yet, so I just left it inside of here. It's just inside of this little thing. We have an entire bag of goodies. We have in here, oh, here's some tape. Okay, so they gave us some more tape, okay? They gave us a good pen light, which we have already used when we have to do our head-to-toe physical assessment check off. It's really bright, as you can see. You see what it did to the camera? Good pen light. So they gave us this one. It also has the pupils sizes over here, and they actually should be between a 3. I think she said a 3 and a 4, I believe. But I know if it's anything in excess of that, then it's like abnormal. So it has the pupil sizes on there. I love the pen light. It's handy because you can use it to look down the throat, look up the nasal cavity, look in the ears. You can use it for a lot of different things. And of course, as you know. Okay, and then also within this bag, and it's just called Pocket Nurse. So within this bag, they give us like a hemostat, they give us suture scissors, all types of things. They give us a little ruler looking thingy, a few tongue depressors. They give us, I'm not sure what this is. It looks like a protractor, but it's probably not. They give us a thermometer, of course. Okay, and a few things to hold your name tag on. They give you some sterile alcohol swabs, and then they give you a pain scale for your patient. Okay, so let me stick all this stuff back into the little bag. Okay, 1 second. Give me some time, give me some time. I hope this isn't too boring. If it is boring you, then feel free to click off. If you're interested in watching and seeing more supplies, then keep watching. Because I don't want to be a bore to anybody. So if it's boring, then please stop watching. Okay. And you guys, I was looking at my scrubs. I hate the way that they fit. So I want to try to, these are unisex. So I want to try to find some better fitting, more feminine ones that show like that curve. So I don't just look like a big box because it just makes me look really wide and I don't like that. So let me stick this back in here some way. Okay, you guys. Then they also gave us some PPE, or personal protective equipment. We've already used this. So it just comes with your hat, mask, gown, cap, gloves, and also sterile shoes or booties. So we've already used this to do our check off. Okay. And we have a central line dressing tray. So it comes with a mask, a pair of synthetic gloves, a transparent dressing, gauze, all kind of stuff. So it's just in this little thing. We haven't used it yet, so it's still closed. We have premium IV starter kit. So it just comes with, I guess this is some of the cleaning stuff. You don't really see too much in here, but it just says premium IV starter kit on it. Okay. And I'm just grabbing it out randomly, you guys. We have a gait belt. Okay, you guys. So it just comes with that, like that. We have a cheaper stethoscope that they gave us. So again, they gave us our better stethoscope. Oops. They gave us the good stethoscope, and then they get like the better one. And then they gave us the cheap stethoscope just in case we ever were to forget our better stethoscope at home. Okay. Okay. Now in here we just have some stretch bandages and some gauze. So here's the gauze and here are the stretch bandages. They just gave a few of each. Okay. Here we have tons of stuff. It's like it came with a rubber band thing on it. So I'm just going to take the rubber band off so I can kind of read to you what each thing is. So here we have a ClearLink system. So it's Continue Flow solution set. So this is to be used for IVs. I don't know if you guys can see it because the camera is so bad, but this is what it is. Okay. And then here we have Cleansing Enema Set. And it just looks like that when you turn it over. Okay. And then my phones are in. Okay. And then we have surgical sponges, more surgical sponges. They gave us more of these gauze pads. They gave us, what is this? Dual lumen stomach tube. Okay, so that's cool. It says a dual lumen stomach tube. And it just kind of looks like that if you can kind of see it's in here. Okay. Then they gave us a suction catheter kit. They also gave us, oh, what is this? These are sterile gloves, but we've already done a check off, so they're open. And you guys already can see, but you dump them out, and then they just look like this, and you do the check off. So let me stick these back in here and get to the next thing. Give me 1 second. This video is running kind of long, and I'm going fast. So we have a tracheostomy care tray. We haven't used it yet. We're going to be using it next semester. So it's still closed. Okay. And we're coming to the last thing in the box. And it's going to be a pre-connected Foley, pre-connected closed system. So it's going to be a 2,000 milliliter anti-reflux drainage bag and a needleless sampling port. And it's a Foley catheter. We haven't used this yet. We're using this also next semester. So it's non-sterile, as you can see, but so it's not open yet. Okay, everybody, so that concludes everything that came in my humongous nursing bag. So this is the bag that I take whenever we do clinicals. That way we can be prepared. And clinicals, by clinicals, I mean clinical lab. So whenever we have lab at school checkoffs or whenever we're practicing skills, I bring this bag to school. So if anybody has any questions, feel free to reach out to me. Again, my name is Vay, and I will talk to you guys soon. Bye.